Thank you and good afternoon. I'm Dr. Deborah Montoya with the Imperial County SELPA. I also have with me Vanessa Lopez, also from Imperial County SELPA, as together we support and assist CDE and CCEE with resources, tools, the dissemination of the California Practitioner's Guide for Educating English Learners with Disabilities and related topics, all related to improving outcomes for English learners with disabilities across California. We thank you for joining our Q&A session today, which is a follow-up with our distinguished guest, Dr. Samuel Ortiz. His vast knowledge, experience, and the resources that he has to share are many. We're very honored to be in this space with him again, although not in person today, but virtually. And for all the attendees that have logged in, we want to encourage all attendees to drop any questions that you have into the chat box. Well, it's actually the Q&A. As the questions come in, we will take down your question and ask them on your behalf. Thank you also to the participants who provided us with questions beforehand. So we will start with those questions first as we engage with a conversation with Dr. Ortiz. So thank you again for your participation, and thank you, Dr. Ortiz, for being here.
Of course, my pleasure. Thank you.
Thank you. And I want to share firsthand what an amazing experience it was to host you for our webinar on the 16th of September. That recording does live on the Imperial County Office of Education website now. So if anyone missed it or wants to share it with friends, that video is available along with the presentation slides. It is a free resource now and a free supportive tool. I have to say the participants as well, as they engaged in a survey just after the session, comments came in such as, he is extremely knowledgeable. It was helpful to learn about the topic from a multidisciplinary perspective when participants shared. Others shared regarding red flags and how to annotate those and explain those when considering and determining language difference versus disability. Someone said, I appreciated how Dr. Ortiz shared realistic applications to all of the information he was providing us. The research-based answers to some very pressing questions on assessing English learner students was appreciated. Your passion on the topic didn't go unnoticed either. So there was comments about your passion, your candor, and your ability to share not only your own experiences, but the experiences you had as a professional and a person who is also, and I should say in honor of Hispanic Heritage Month, those of us that are Hispanic, Latino, Latinx, to be and proud and honored to be in this space with you. So thank you again for all of your explanations and rooting us really in the why that we do this work to assist and support students and having access and equity in all grade levels, across content areas, and in social contexts. So with that, let's get started with some of the questions that came in. So I will start with, there were two questions that were relatively the same, and they were rooted in systems work and how do we work with our systems in schools. So the question would be, what would your recommendations be in relation to the how to make systematic change to address students' needs? For instance, as school psychologists conducting evaluations of students who are still learning English, whom are struggling, but perhaps are not eligible for special education. What might your recommendations be?
Yeah, I didn't get on my soapbox too much because a lot of this, or a lot of the answer to this question is actually somewhat political, right? It's rooted in activism. What are you going to do? If you had all the authority and all the power, well, then it's easy to decide what you want to do. But when you don't, you kind of have to fight for it. And I think that one of the slides that I showed, the one with the Thomson Collier data that was actually showing the different outcomes from students in different types of educational programs, okay, like getting ESL only, let's say ESL pullout versus ESL content versus transitional bilingual, late exit maintenance bilingual versus dual language. The outcomes are so great by the time you get to 12th grade that automatically creates a decision point for all school boards. If you want your ELLs to succeed at the highest rate, then you have to have that type of educational program. And the reason for that, I explained, I think, was because of development, that if we toss out the development that children bring in, we will always be artificially handicapping them. We will always be making it harder for them to succeed, not easier, despite our good intentions. So there's no real way around that. And that means that any advocacy, any kind of work has to be on getting people to understand that the only way to improve the education of English learners is not to think that getting there comes merely from teaching them how to listen to, understand, or speak English, and then they're going to be fine. As I also pointed out during the presentation, that's just BICS, but it isn't enough to get you through school. It may make you sound like you're a native speaker. You may walk and talk and look like a native English speaker, but you're not a native English speaker, and your achievement will not be on par, not on average, right? And that's the key. If you're going to advocate, we have to advocate for programs that promote the development of what children bring in terms of their language. And that means it's got to be some form of native language instruction. There is no other way around that. Now, that's not to say that what you already do does not work. That's not what I'm saying. What I'm saying is it's not enough to be able to catch children up, so to speak. That's the problem. If you're trying to catch them up, if you want to truly improve the educational outcomes of your English learners, it's not going to happen by some magic instructional strategy. But teaching children properly still does work. For example, peer tutoring. Why does peer tutoring work so well? Because it gives the child comprehensible input from a peer. But a teacher can do that as well. Maybe it's harder because you've got more kids along the language learning spectrum, so it's hard to figure out how to adjust the language. But that's why that works. Small group instruction. Why? Because you're giving the child more exposure. I talked about how when children go home who are English learners, they don't necessarily have English at home. So they're not getting that benefit when they're at home, whereas a monolingual English speaker gets English 24/7. So the lack of the same amount of opportunity to learn and be exposed to really solid English models, English language models, is not there. The more you can do to help, the better it will be. Does that ever catch them up? No, that's just not going to happen, but it does help. So there isn't any magic sort of curriculum. It's really all about doing what you're doing, continuing to do it, and try to do more of it, more intensively. Remember, it is an experiential difference, okay, that's rooted in a language difference and even a cultural difference very often. And because the child does not get the opportunity to learn these things to the same degree, to the same extent as their same age monolingual English speaking peers, that difference will always exist. And the best that we can do is to try to say, well, then let's not put them behind in the first place. And that's the key. You continue that development with whatever they bring in, and you will increase the achievement of your English learners en masse, not just one or two here or there, but en masse. Otherwise, like I said, it comes down to advocacy more at a political level, getting your school board to understand these issues so they can say, you know what, okay, we'll vote to change our, ESL pull out into a late exit transitional, or I'm sorry, late exit maintenance type of program. That's what it takes: resources, money, and a commitment from the top on down to be able to do it.
Thank you, Dr. Ortiz. I appreciate that, especially in California as a foundational tool in consideration of all needs of English learners is the EL roadmap. The principles that are found, the very first principle is assets oriented and needs responsive. And that's something that in our work we also advocate for, is understanding that having a primary language other than English is an asset and can be utilized to build bridge into the new language. And as we are responsive as schools and as systems, it may need to take some change. And if anything, perhaps even to ensure that the basic core services are provided, which is comprehensive ELD, both integrated and designated at that very foundational tier 1. So thank you. But I'm going to turn to Vanessa because she was going to read over. We received an interesting scenario that we thought would be a great question.
Prior to that, Debbie, I want to head on over to our Q&A section. Thank you, anonymous attendee, for dropping in your question. Please feel free to do so. Related, Dr. Ortiz, to your recommendations, this question asks, do you think that a co-teaching approach in K2 between a general ed and an ed specialist teacher, might that strengthen our education system?
It does, and it's effective because you're keeping the child in the classroom. And by keeping them in the classroom, they continue to get exposed to the content of the classroom. Anytime a child is pulled out for whatever reason, they're not getting that content. And English learners are already behind. So you're just putting them further and further behind. So bringing the instruction to them and bringing the services to them within that type of setting is quite effective in keeping them in contact with what they are supposed to learn, as well as being able to provide more comprehensible input. The more you understand in terms of what's being said, what's being expected, how it's being explained, and what you're supposed to be learning, the better you're going to learn it. The more it's a mystery to you because you just don't get it, the tougher it is. So if you get pulled out and you never heard it before, then you're just not going to get that information. So yes, I think that's a terrific strategy. Nothing wrong with doing that at all.
And related to that, also coming into the Q&A, is that there are times that when parents enroll their child and designate them in the home language survey as English only, therefore not having them have access to ELD, when there is really primary language exposure and engagement in the home, do we still proceed to test them as an English learner?
Oh, yes, absolutely. IDEA does have that one requirement that I went over that says if the child is limited English proficient, so that's an official federal designation. The state does that with the LPAC. And once they pass the LPAC, they remove that designation. But the removal of the designation doesn't remove the English learner status, because an English learner will always be an English learner. You're a bilingual person with bilingual development and a bilingual brain. That's never going to change. So they absolutely should be evaluated as if they are an English learner, because they are an English learner. They're not necessarily limited English proficient. And I laugh sometimes about the home language survey because I remember the questions. You have like, what language did your child first learn to speak? What language you speak most frequently in the home? And in Encinitas, when we would send that home, some parents would request all the documentation in Spanish. So the home language survey was translated into Spanish, then that would go home. And then we would get the responses back, right? It's written in Spanish. What language did you first speak to your child? What language did your child first speak? Whatever. And it's written in there nice, beautifully, Inglés, right? Inglés for all the answers. That's like, come on, who are you trying to kid? Parents don't understand any of these issues well, because they may not be very well educated to begin with. And even if they are, they're still complicated issues. So they think, I just don't want to rock the boat. I don't want to get my kid into trouble. Or they're like my mom, who said to me, okay, as an adult, well, even if they had bilingual education when you were a child, mijo, I wouldn't have put you in it. I'm like, well, why not, Mom? Because I wanted you to learn English. And I'm like, I would have learned English and I would have learned it better. So they don't understand. And you cannot go by simple parental responses or state designations with the LPAC. You have to say, has this child had any significant type of exposure to another language? And if so, that makes them an English learner, and that should entitle them to a non-discriminatory assessment, the kind of which I described in the presentation.
And related, I love how these questions keep coming in as we're engaging in conversation and uncovering the initial questions. Now this one is related more to SLPs, but in how to best assess them, because we understand that standardized tests have built-in cultural biases. So many English language learners will qualify as having a disability as it relates to speech and language when maybe they don't. What are your thoughts on that?
Well, I really, I should say, watch the video, because that was exactly what I talked about. Tests aren't biased in that way. Tests are merely reflecting a different developmental characteristic that it does not control. So that doesn't make it biased, but it does make it invalid. And that means that, yes, if you use a test in English, you get a low score, you're going to think, oh, that 72 is too low, so that means the kid has a language impairment. Well, that was, what I spent the afternoon on in terms of how you can deal with that issue directly, particularly via the use of the cultural language interpretive matrix. And one of the questions that was written that you gave me ahead of time was actually a speech language path asking, could they use the CLIM with just speech language tests, even though it only, fell into, let's say, level 4, level 5, like the cells at the very far right, which are language oriented? And the answer is yes, that's plenty to be able to use the CLIM, because you're only looking at language functioning. If you were trying to evaluate for learning disability or for intellectual disability, that would not be enough. But for language, absolutely, it's enough just to look in those areas. So the key is in making sure that you take your scores and you evaluate them properly, as I had outlined, to be able to determine how much of the impact was due to culture and language. And then was there any additional impact beyond that, which might then suggest the presence of a disability? That was exactly, I think, how it needed to be done. And the afternoon with the case study and going through that, I think I was able to demonstrate how you can do that, even with tests that are in English and even with the administration in English. It's much more difficult to do that in the native language, unfortunately, which is why I relegate that to the secondary status in terms of following up if you can establish a weakness in English first. That way you don't have to be as dependent on the exact score validity of the scores in the native language. So I'll leave that because I discussed that before, but absolutely there are ways to do it. And I think I've outlined a reasonable and practical way for people to do it. I think I spoke quite directly to the speech language pass during the presentation as well, because I don't know if we had one or a couple in attendance personally, but I know there were many online as well.
And also related to that, how can we determine the slope with just 2 bars on that graph?
Because you really you're not looking at the overall slope, you're only looking at the performance in those 2 bars. So therefore, all you're really looking at is, do they appear to be below the expected range? How, the line that is there is telling you for tests in these cells, this is how much impact should be there, which can be at least 1 standard deviation or more, depending upon how different that child is. In other words, how much development in English they have had in their life. So that score could be quite low, but that's still due to culture and language. And that's all you're really looking for in the speech language evals. It's not really, 2 bars can give you a little bit of a decline. You would expect that the ones in level 4 might be a little bit higher than the ones in level 5, but because there's not that much of a difference, you're not going to see too much of a decline. What you're really looking for is, are the scores lower than where they are expected to be? In fact, let me go ahead and I think I can share my screen and I'll show you exactly that slide that I had before that kind of highlights that. And it was this one. And let's see if I can share. Yep, I can share. Okay. So I'll do this. And you should see, I'll make it bigger here. You should see the slide there. And look, it wasn't the one, it was backwards. It was this one right here. So these are 2 slides. This is from the cell 5. So if you gave the cell 5 as a speech language path, this is where the subtest would load, and these would be the bars that would be graphed. So in this case, I see that in level 4, which should actually have been either equal to or maybe a little higher than level 5, is actually lower, which is already an unusual pattern. It means that that performance was not only worse than even more language demanding tasks, it was also, as you can see, it was below, forget the variability, it was below the expected range there. So to this point where this line, crosses right here, this is how much of a decline we can say was due to culture and language. That's the average amount of decline. But what about those extra 15 points or so that it went down? Well, that has to be due to something other than just culture and language. And that's where then you would say, well, my results might actually be valid, likely valid, and I would move forward with the evaluation to see if I can actually establish that as being a true weakness. The one on the right-hand side in level 5, that's actually right where it needs to be. I think that any follow-up there is probably going to be unnecessary unless there was variability, and there might well be. But any scores within that range, right within this range here, in terms of language, should be considered average, must be interpreted that way. Otherwise, it would be discriminatory because it would already be low enough to suggest a deficit when in fact that's not a real deficit. That's just culture and language bringing it down. And since it's not lower than that, then there's nothing else to say, well, there could be something else going on. So this is an example of how that interpretation would work. It was one of the slides that I showed. So there's more explanation as well available in the recording.
Thank you, Dr. Ortiz. And Debbie, I'm wondering, since we already touched on CLIM, do we want to jump into the CLIM questions before we get to the scenario, just to keep it in the same vein?
Yes. So there was lots of questions regarding CLIM, and I'm going to drop the, if I can, the free resource. So the free CLIM website was provided in the session on the webinar, and then we'll post it into the Q&A in just a second. In relation to all the free resources, those of you who opened up that file, you'll see that there's also a PowerPoint in there. There is a scenario for Carlos and Maria, a triennial evaluation. So lots of supplemental resources in there that are free for you to utilize to support you as you start your journey with CLIM, or maybe continue to hone your craft with CLIM. But a question that came in I thought was great, and school psychologists posed this question. While I plan to implement the CLIM interpretation for my English learner students going forward, many of my students are on their second or third year triennial evaluations. I usually don't have the luxury of completing an initial level test battery for all these triennials. During a previous training, a trainer had addressed this issue by informing us that we could use some previous test scores to supplement current test data for the XPAS or CLIM interpretation. Is this true? If not, what would your recommendations be for a streamlined battery for a triennial evaluations of English learners?
Yeah. So the regulations regarding a triennial, according to IDEA and the attendant regulations, are often really misconstrued. And it does not say that the child, him or herself, has to be reevaluated. Likewise, it does not say, and if you look through the entire wording in IDEA, you will never find the words requalification. So there is no need to have to say this child still has a disability or still meets criteria for eligibility. That's determined once. If there's a decision regarding whether or not a child still needs it, it's likely because they no longer need the services, not that they no longer need or have a disability. Okay, two separate things. IDEA does not cover temporary disabilities. If you catch, the flu or you have a cold for 10 days, you don't get special ed for that. If you break your leg, you don't get special ed for that unless that leads to an orthopedic impairment. You don't get temporary coverage. You get coverage for a disability that is typically thought to be long-term and lifelong, with minor exceptions. For example, a speech language or just articulation only IEP, where you know that early intervention is necessary. You don't even have to go through the whole process just to be able to get a quick articulation therapy service so that the child can enunciate better and then remediate and then move on. So that's one exception. But if you have LD, the kid doesn't have to be LD again. So there really is no compelling reason to have to do a complete and full reevaluation. That's a waste of school psychologists' time, pretty much everybody's time, unless there is some doubt about the previous data and information. So the speaker who was saying you could supplement what you had before with some new information is 100% correct. That would be perfectly okay. And what I would do is, if you had any questions about the initial evaluation, all right, then any data that you believe are suspect, you could then say, well, that's what I'm going to then reevaluate. If you have data that you believe are valid and good, no need to redo them. It's not likely to have been changed if you think that they were valid in the first place. So reevaluations may only be necessary in cases where there is a change in the nature of the disability. Number two, you're considering removing the child from special ed because they no longer need or require the services. Number three, there has been, let's say, an increase in the impact of the disability on the person's learning. Some disorders, some disabilities can get worse, and that means they may need more services. In those cases, you may want to see what the current need is, all right? Or if you don't know what that original evaluation was like and you're not sure of the validity of it, you could do a complete reevaluation to make sure, right? But if you have good evidence from before, you think it's solid, you don't really need to reevaluate the child or the disability. Think of it as reevaluating their current level of need. Deborah, Dr. Montoya, you mentioned on the website there are different reports there, and I think I'm trying to remember if there is a triennial one available. I think there is. And in there, the way that report is written, it's really looking at what are the questions you're asking at a triennial. And so the point should be to gather data that are necessary and relevant to make the decision for a triennial. And that decision is not eligibility. That decision is, does the child continue to have a need for special education and related services? And if so, are the current goals and objectives meeting that need, or do they need to be revised in order to better meet that need? And the data you collect from whatever you do in the reevaluation need to answer that. Retesting to see if somebody has LD is never going to answer that and is not even necessary. The disability is not supposed to magically go away. Now, that said, okay, if you have a case where you think the child was misplaced in special education and you think something is wrong and you have a complete evaluation from before, you could take those scores, drop them into the CLIM and see what you think. And that may help guide what that person should have determined before and did not, in which case you can bring that up and say, I think there's grounds for removing the child because I don't think they have a disability at all. So that's a possibility as well. Remember that the CLIM is just an examination of the impact of culture and language on the data that were used to make a decision. And if you can determine that culture and language were really the primary determinant in that decision, then that's not a child who should have been identified as having a disability. That's an exclusionary factor, and that child potentially should be removed from special education. Now, that's an IEP team decision, but if you don't have a disability, you're not supposed to be in special education. And I know I hear all the time, but that's the only way they're going to get extra help. Yeah, I get that, but I did mention that it's called the Individuals with Disabilities Education Act, not the Individuals Who Need It for Whatever Reason Act, or, this is what we're going to do because we won't do anything in general ed. Sorry, that doesn't fly. That's not legal to do that. And I don't like being a part or recommending anything that is not legal. So I hope that clarifies. It's mostly policy that makes school psychologists and speech language therapists have to do these reevaluations. If you can talk to your administrator, show them the actual law, ask them where it says I need to retest the individual, and where do we redetermine eligibility? Where does the child have to requalify? And when they are unable to answer those questions, maybe they'll say, you're right. Let's change the way we do triennials. That would make a lot of sense.
Thank you, Dr. Ortiz. And as you were discussing and during the webinar as well, a vast majority of the conversation was about SLD. As we know, oftentimes there is a larger amount, a higher frequency of English learners who are in that respective disability category. And that's what we've noticed across the state. Of all the disability categories, it seems that SLD with SLI as a close runner-up of English learners being in those pockets of identification eligibility. And whether assessments were valid and reliable, we would hope so, as professionals and doing our obligations to conduct ethical, reliable, and valid assessments. But as we also recognize that all the other disability categories that we're trying to either rule out for a student, one of the questions that came from the Q&A was a few disability categories involve atypical language development, which is a critical element in their diagnosis. For instance, a child with autism, a child with a hearing impairment, and many students who are English learners that also are indicated as eligible under autism or hearing impairment. The school psychologist may have considered utilizing the CLIM and is asking, could Dr. Ortiz elaborate on nuances in the interpretation of the CLIM one might see in these non-SLD populations when the confluence of EL impacts and language development delays as part of the disability are critical to understanding how to support the students?
Absolutely. Very good question. All right. So I'm going to share again, and I'll go with this particular slide here. So because the research has been conducted on English learners who are of average ability, okay, that means that we get this decline that follows this green line right here. Now, as you can see in this illustration, that line isn't following that. Well, it is, but it's much lower. So what's happening here is that there's some variable, some influence that is more or less uniformly depressing all the scores. So there is an effect of culture and language every time you test. However, the overall performance is not within the magnitude that the average English learner generally performs in, who is of average ability and is not disabled. So with these scores being that much lower, 15 to 20 points, you're probably looking at one of those other categories. This is not LD. This would be intellectual disability. This could be a child who may be on the autism spectrum if they have low, let's say, cognitive functioning across the board, as well as language difficulties. This could even be a severe language impairment in a young child whose language is so impaired that even nonverbal testing is difficult to do because they don't respond to it well. So this could be many different things, right? And they mentioned even perhaps a child with hearing impairment. If you're trying to measure their spoken language and they have hearing impairment and nobody's been teaching them sign language from birth, you're likely to get a pattern like this too. And what this means then is that this development is due to a variable that is larger than just culture and language. And culture and language are present. Culture and language don't disappear, but they may not be the primary determinant of what you measure. And if it's an overall pattern of decline, then clearly some other variable is out there that is creating this global cognitive impairment or some kind of general intellectual disability of some sort. And you're seeing that. And that's what this would tell you. So I wouldn't look at this and say, oh no, this is just culture and language. It's got to be something else. But I'm not looking at this and thinking that's LD either, because the scores are low. If you compare that now with this one, and I showed this one as well. In this case, you notice that on some of the tests that are lower in language, the nonverbal types of tests, more or less, the performance is pretty much average and where you would expect it to be for an English learner. But as you move to the right, the scores really drop considerably. And that's because in this case, only language is really interrupting the overall pattern of performance. When you remove language from the performance goes up into the average range. So this would indicate this is the type of child I would not say meets criteria for being, let's say, intellectually disabled. This would not be ID because they have solid functioning in many other cognitive areas, and it's particularly limited to language. So this is either a language impairment of some kind, right? Or, you could say that maybe it's like a speech delay, okay? It's affecting aspects of speech language functioning. So those would be the reasonable explanations. But ID wouldn't be a part of it. And I certainly wouldn't go LD primarily because of the importance of language functioning here. It's showing that language is really pretty low. And in this case, all of the other abilities might be closer to the average range, which then wouldn't suggest LD. So you'd be able to say, no, I think it's probably just a language issue. And the CLIM isn't designed necessarily to be diagnostic in this sense. I did show you some of the research on how that works, which looks like this. The blue line being normal English learners, the yellow line being English learners who had been identified as having a speech language impairment. And you see how they're very parallel. They're cognitively intact until you get to about moderate language, and then it starts to diverge a bit there. Whereas when you look at the children who are English learners with intellectual disability, it kind of parallels that blue line, but it tends to be far below that performance across the board. Does that mean intellectual disability per se? No, it could be autism. It could be Down syndrome. It could be other types of disorders that have intellectual disability that is a part of it, some kind of pervasive developmental delay. So it can be many things, but the CLIM can again help you determine, is culture and language present to an extent that it can explain my scores? And the answer for here is no. Culture and language cannot explain the entirety of those scores, and the answer is no here as well. Culture and language cannot explain the entirety of those scores. They're present, but it's not the primary reason.
Thank you. Thank you for that response. I think that's very helpful. As one of the things, as you were describing, it resonated with me during the original webinar, as I appreciate you taking time about the fact that English learners are not a homogeneous group.
Right.
And when we consider the needs of English learners, given their respective levels of exposure and language proficiency and language acquisition skills, I think that came into mind as we considered our assessors and as they plan for that, just the development of the assessment plan, let alone conducting assessments. If you could speak a little bit more to a key point that you had made during the webinar, which was regarding language matching and culture matching.
Okay. We often take it for granted that Spanish is a monolithic language, that we all speak the same Spanish. And the funny thing is, there's only one type of Spanish that everybody can understand. It's called consensus Spanish. And the only time it's used is on a standardized test, because when tests are standardized, all of the developers and the authors get all panicky and they want everybody to understand it. So they develop an actual form of Spanish that is called consensus Spanish, that all of us who speak Spanish can probably understand. Now, understand also that consensus Spanish is a language spoken by nobody in this entire world. That's not how it works. So when you're working with a child, you can't assume that Spanish is Spanish is Spanish. So when you, let's say, don't speak Spanish and you're not aware of that, and you have to call in a translator or interpreter, you don't want to just say, well, I've got somebody here from, let's say, they're from Baja and they speak Spanish because they're from Mexico, but I'm working with the kid who comes from the Dominican Republic. And then just assume that whatever the person translates in their Spanish is going to be completely understood by the kid who speaks Dominican. It's not 100% that way. And it's enough to create difficulties, particularly when you're dealing with specific types of vocabulary. And I gave, the examples of like, the difference between autobús or camión and guagua, which we would use in Puerto Rico, or lentes, anteojos, and gafas versus espejuelos, which we say in Puerto Rico, or naranja and orange versus china, which is what we say in Puerto Rico. So these things can be misunderstood, and that can be a problem. I mean, it even goes beyond that in terms of the cultural heritage as well, because I don't know if I can put this without being too vulgar, so I'll sidestep the actual wording. But I had an issue at San Diego County Schools. I was doing some consultation where their chief interpreter got a call that they needed somebody immediately because the interpreter that they had, who happened to be the school's custodian, pulled into into a student study team meeting. He got offended at the mother's speech. The mother happened to be Cuban. And if you know Cubans, Puerto Ricans, Dominicans, we like to use a lot of four-letter words, although in Spanish they're not all four letters. And it's a normal part of expressing ourselves, which really doesn't mean that we're all angry or we're trying to be vulgar. It's just common accepted way to go, right? It's like, hablar de tú. We use the informal all the time. That's who we are. So the translator had listened to the mom use a couple of these, and he just got up and left because he said he wasn't going to sit around and do a translation for a woman who was being that vulgar. And so they had to call somebody to come in, and the woman that went to do it was a friend of mine who told me the story, was laughing because she understood exactly. It's just a cultural issue here. It had nothing to do with any real problem. So it's necessary that you understand the child's development much more than on a superficial level. It's kind of like, we would say, well, all kids who speak Chinese are the same. when, you have differences between Hmong and Cantonese that are all important. And some people who speak certain languages of Chinese can't even understand other people who speak other languages of Chinese. So we tend to generalize a little bit too much, and having the sensitivity to make sure that we are taking the time to ensure that we're not misunderstanding the child's language or cultural values or attitudes and behavior is very important.
Thank you so much for that explanation. I know, and I'm sure many of the assessors here on this webinar, as we're in the first session, appreciated your explanation as well, as we recognize that throughout California, there are students of various language, cultures, ethnicities, and dialects within languages as well, which makes it equally challenging for the assessors and for students and communities to ensure that we truly are being respectful and acknowledging all that they bring to the table as individuals. As every student has skills and abilities, we may not have the right interpreters, and how we go about that can be very challenging. And I appreciate whenever participants ask those questions, because we recognize that that is difficult. So related question along those lines was regarding exposure, and in your experience and students that you've worked with and all the consult that you've provided across the US, not just California, can you define what you feel is exposure as it relates to how many years a child has been exposed to English? Would we consider the years of education English, also students who are bilingual but have never had formal education in a country other than the US? So share a little bit about your, not only your recommendations in those scenarios and the interpretation of exposure.
Yeah. Okay, so I'll go to this particular slide here. As you mentioned earlier, Dr. Montoya, not all English learners are the same. You could have two kids who are 10 years old in the same grade, right? Both from the same country, speaking the same language, but one of them might have been learning English since kindergarten. The other one started learning English just last year. So they're not comparable. You can't say, well, they both should be doing the same, because one has had far more English language exposure and development than the other one has. So that was one of the adjustments that the early CLIM needed to make. And we're able to do it crudely at best with 3 different categories that I call degree of difference. And really, it just relates to the concept of exposure. And how you can determine that is based on pretty much all the things that you just mentioned, along with things that I've listed here that can help somebody figure out what's going on. Now, it isn't merely passive exposure, and I tried to emphasize this, I think, but maybe not enough. It needs to be active and engaged learning. If I am home and I'm watching TV, other than Dora the Explorer, I'm not really being taught to speak English. I'm just hearing it. And without somebody there to make it intelligible to me, without somebody actively trying to communicate with me in that language, it's really not very good exposure. People often say, well, what about the siblings? The siblings coming home and they're talking to the child. Yeah, but are the siblings just talking over the child, or are they actually trying to help the child learn to speak in some way? And you can certainly count some of that. I wouldn't discount sibling interactions, but remember, that's not formal. Schooling is quite formal. The years of schooling is very powerful English language exposure. There's direct intent to teach the child English. In fact, that's a Title III issue for all districts. They've got to get their English learners to learn English. You give them the LPAC to measure whether or not they're even getting it. And when they've had enough of it, we say, good, you're done. And now we don't need to teach it to you anymore. Now you're on your own. But when you stop and think about that, remember that a child may hear English primarily, if not exclusively, at school only. And that's tough. When I went home, I didn't hear English from my parents because they didn't speak English that well. And my English was already better than my parents' English by 3rd grade. So the fact that they were speaking English to me really wasn't benefiting me all that much. Compare that to a monolingual English-speaking child. When do you think a monolingual English-speaking child has the same level of language as their parents, assuming, let's say, their parents have nothing but a high school education? Well, that's going to be when they get to 12th grade, pretty much finishing and wrapping up their own high school education, right? So my parents didn't have high school education in English. They had it. My mother had it in Spanish. My dad did not. He got his GED much later on. So what was their English like? Third to fourth grade level, maybe. I was already there by third grade. So this is what you want to look at. The child has to be actively engaged in the process of learning English. There has to be direct intent to teach. There has to be, language models to promote the child's learning, to give that child comprehensible input. And a lot of things influence that. Parental level of education and literacy directly influences that. The higher educated the parents are, the more language exposure that child's going to get. The higher the SES, the more opportunity there's likely to be to engage in the language. All right. The more English proficient the parents are, the more likely they'll be engaging in the language. Right. The less they are, the less they're going to be engaging in it. You may have siblings, the younger sibling will likely get more English than the older sibling. There's an order effect there, birth order effect that you could account for. So it's all of these things. You can think of it generationally. I talked about how I'm a second generation child, meaning I'm born in the US, so I'm first generation born, but I'm second generation because my parents were first generation to come to the US, okay? So that makes me second. That means my children are third generation. So my children are slightly different English learners. Why? Because primary language is English, dominant language is English. They've heard English pretty much from birth, but they haven't heard English completely and only. My children are still English learners. Are they ever going to get tested to have to take the LPAC and be identified as English learners? No, their English was way too good for that. But that doesn't mean that there isn't an effect on their own test scores. There certainly is. And that should help you kind of figure out where they should be. I'm second generation. I will always be moderately different. And the markedly different is just reserved for those kids with very unusual developmental circumstances, living in refugee camps, growing up in an orphanage, being adopted by parents who speak a different language after the age of 3, interrupted formal education, or not having any prior formal education coming to the US before, let's say after the age of 5, right? Very low SES, in fact, extreme poverty, homelessness, exposure to war, trauma, neglect, abuse. All of those things can just really affect the language development more so than it would for a typical child. And that's why you would then use marketing. So they are rough categories. You don't have to pinpoint it. There is some good instruction on this as well in the Ortiz PVAT. When you go to administer the test, there is a question that helps you try to determine. It asks it in a weird way by asking, at what age did the child first begin to learn English? But it clarifies, saying what we're really talking about are active learning experiences. And sometimes you have to figure that out. If you truly, for example, had 2 parents, one who spoke English only to you and one who spoke Spanish only to you, by the time you're in kindergarten, your exposure to each of those languages is not 100%, it's 50% of your life. That's just mathematics. You can't have heard both languages simultaneously at the same time for 5 straight years. That's not how it happens. So if it was completely balanced, it's 50-50. Does that have an effect on your performance? Yes, it does. But regardless of the language of instruction, whether it's English or Spanish, you got a parent who's going to be able to help you out, support that development, and in time, that difference in vocabulary and exposure will wash itself out. But that's because you can support either language. So you want to take all of these factors into account to have the best estimate you can possibly of this degree of difference, of the amount of exposure. I am working on possibly some ways of maybe helping quantify that a little bit more. I did show you the CCAST, Catherine Collier's system, for being able to do that when you're analyzing the content of the test. But I am working on some ways that maybe will make it easier. So perhaps in the future, I'll get rid of a little bit of that anxiety because you have to use your clinical judgment here. But right now, that's the best you can do. It has to be your determination based on what you know of the child, which is why that developmental background is so important to know and to detail.
Thank you, Dr. Ortiz. On that same line, I think as you mentioned, our practice as school psychologists, myself having been a school psychologist quite some time ago, and knowing that we may have newer novice school psychologists or speech therapists, in our session today, as well as highly experienced and seasoned, maybe even bilingual school psychologists during this session. I thought it would merit some time for you to perhaps review the slide that you had regarding best practices framework for non-discriminatory evaluation of SLD. I thought that was a nice visual interpretation from pre-referral to decision-making that might be helpful for the field.
Absolutely. Okay. So let me grab it here and I'll bring it up for you.
As you bring that up, I want to encourage participants, please enter any questions you have in the chat box. We will read those questions aloud. If you have any wonderings, any follow-up questions as we continue through this session, feel free to add them to the Q&A box. Thank you.
Okay, so these are the 5 basic elements of non-discriminatory evaluation. And this is a broad framework that would be useful in virtually any type of evaluation, even with the monolingual native English speaker. It's just easier to do with a monolingual native English speaker because when it comes down to testing, all your tests are valid to begin with, so you never even have to worry about that. They control for language by age, and that makes good sense. But for an English learner, you're really emphasizing important things. The first part, the first 2 elements of those are pre-referral activities. And those are crucial because they provide the context by which you later are examining additional data. This is where you go in and say, number 1, have I given the child sufficient opportunity to learn? For example, with LD, you can't evaluate for LD on day 1 when a child enters school because you haven't even had the chance to give, or you haven't given them the chance to be able to demonstrate that they can learn what you're about to teach them. So you need time. And remember, if they don't speak English and you're teaching them in English, you got to give them time to learn English, then give them time to be able to demonstrate that they can learn now that they understand exactly what you're saying. So that's an important component. Don't rush to judgment here. Give the child time to be able to do that. Now, of course, if there's an obvious disability of some kind, like the child may be blind and there's physical manifestations of blindness, then yeah, you don't need to wait. But in cases like LD, where you don't have direct kinds of, let's say, characteristics that you can observe that tell you that there's a disability likely to be present, you need to have that time. And then when you're doing that, you want to monitor that learning. If I don't know English, and let's say I am 9 years old and I come to the US, you're very likely to drop me into 4th grade. Now, how am I supposed to learn 4th grade material in a language I don't even comprehend yet when I've had no prior formal schooling? Meaning I don't read, I don't write, I don't do math. And yet everybody at my age is at a 4th grade level in all 3 of those skills. I am so far behind. What is reasonable for you in terms of an expectation of me in catching up? It's like I would have to be a genius, innately so capable and talented that I can learn so much faster than everybody that I'll eventually catch up. The average kid isn't going to be able to do that. And so you must monitor that progress and say, is this child making comparatively similar growth to other children who are similar in terms of their background? I'm not going to compare that 9-year-old student with no prior formal education to a 9-year-old who started kindergarten. That's not fair. That 9-year-old has had 4 or 5 years already, 4 or 5 years of English language development, and this kid has not had any of it yet. So that true peer comparison has to take that into account and say, well, we can't necessarily expect this kid to be at grade level by the end of 4th grade. Probably not by the end of 5th, 6th, or 7th either. That's just unreasonable. But that doesn't mean they're not learning. That doesn't mean they aren't teachable. That doesn't mean they're not making progress. It just means if we measure that progress incorrectly, right, through incorrect peer comparisons, if we hold unreasonable expectations of where that progress should be, if we hold the grade level standards as sacrosanct, and that means if they're not at that level, then something is wrong with them, then we will invariably identify that child as having a problem, or then we'll refer them. to the two central parts where we'll say, okay, school psychologists, speech language paths, you guys tell us whether or not this kid has a disability, because look, they're not doing very well in school. You know, it is true they're not doing very well in school. But if those elements were not in place, no sufficient opportunity for learning, and the true peer comparisons were not being made, they were, you know, what I'd call faux peer comparisons, because they appear like they're peers, but they're not really, all right? And that just prompts the referral. Clearly the child is not doing well, but that's not because they necessarily have a disability. And suddenly they want you to find out whether that's true or not. And I put that asterisk after, you know, evaluating in English first, because I reference again the next slide that came after this, the idea that there may be times when those of you who are bilingual may feel it most appropriate to evaluate in the native language first, which can be quite problematic. But if you believe that's most appropriate, then there's no reason why you can't start that way. Generally, that's not going to happen for LD, because for LD, you would have had to have ensured opportunity to learn. And if you didn't, then you shouldn't be evaluating. That would be highly discriminatory just to begin with. So you've given them enough time to learn. That means they've had enough time to learn English. It's easier to just start in English for the reasons that I explained. So at this point, you're now trying to focus on issues related to the testing process. If you're using testing, if you're using other information and data, then that's fine. You're still in some way trying to identify weaknesses and deficits that may constitute the basis for determining a disability. And I gave you a way to follow that and how that goes through. And then ultimately, remember, the last thing you do is to take the information from the first two, combine that with the information from the next two, and then say, does it all make sense? Is there a logical relationship between the two? Can I say that what the teachers were reporting as difficulties in the classroom are explainable by the cognitive or linguistic deficits that I have identified through my evaluation over here? And if they go together, then you have another layer of validity evidence, which promotes the ecological validity overall of the determination that there may well be a disability. And so this is how you go through that final stage. You can't even use that final one, the decision-making, until you know everything about that child. If you don't know that the child, you know, came to the US at the age of 8, had no prior formal education, is now 12 years old and in 7th grade, right, and struggling to learn, but you didn't know that they didn't start school until the age of 8. You didn't know that they didn't have that prior formal education. You'd be thinking, well, this kid is really super far behind. There must be a problem. And that lack of context is going to be discriminatory. And that's why it's so important. You want to have detailed analysis of this. I mentioned that speech language paths are already trained to take a very detailed language history on an individual. Well, school psychs, you've got to do that too, not just language, but all forms of development, cognitive development, emotional development, and make sure that you know what has happened to the child so that you can say, my results are consistent with what I'm seeing. Because if it's not consistent, then it's something else, and it's not likely to be a disability. So, Dr. Montoya, does that kind of address the framework that you were hoping, or is there any particular part you'd like me to emphasize or cover even more?
Thank you. I absolutely appreciate the emphasis on the pre-referral activities. And I think we've heard multiple times in different venues with school psychologists where they are found in these situations where they are being asked to assess, where the referral has already been made. Perhaps there is not a 15-day period to truly review the case, and an assessment plan is needed and necessary based on that recommendation of the SST team. But the importance here of those pre-referral activities cannot go unnoticed. And it's unfortunate when we don't have enough data and support regarding interventions, whether accessibility tools were utilized, how long those interventions were put into place, what in fact did designated and integrated ELD look like for the child prior to referral. And I think that's where many times our school psychologists are stumped, for lack of better words, because then it sets them off on a path of what is the actual area of suspected disability? What am I assessing for, and how should I approach this assessment in relation to materials, need for interpreters, etc. So I think that's a great question. I do have some questions in the chat box from SLPs. So there's a question that says, After the CLIM, you suggested follow-up assessment in native language.
Dr. Joe, before I answer
yes.
that, can I add one more thing to that last
Yes, absolutely.
question? Because this was in some of the questions you sent me earlier as well. People were wondering, can we use the Ortiz PVAT in terms of pre-referral applications for progress monitoring through an RTI framework? And the answer is yes. In fact, what you see circled here are at least 6 different ways in which you can use a standardized test like the Ortiz PVAT for pre-referral applications. It doesn't have to be diagnostic only. And people sometimes get a little scary about that. And I show them this slide, and I did show that in the presentation, that screening for instructional purposes is not evaluation. And it's just clearly stated in IDEA. So as long as you're trying to intervene, which a lot of the questions were, we addressed earlier, but also in the written responses, were indicating, what do I do? Well, if you give something that helps you determine whether or not your interventions are being successful and what can be done in terms of what to apply, then you have a way of being able to do that. In fact, I showed that, the instructional recommendations for the Ortiz PVAT here give you the level of instruction, and then all of these strategies can be implemented pre-referrally as well. It doesn't have to wait until the diagnostic stage and identification stage for you to have to be able to do that. Okay, a question from the SLP.
Thank you. So we have had several SLPs ask questions, and I think they're all along the same notion of what might be your recommendations for a culturally and linguistically appropriate battery in addition to any perhaps native language or SLP assessment tools in languages other than English that perhaps you recommend.
Yeah, so I think I mentioned it as part of my recommendation previously in the presentation, that the reality is there is no single one test that's going to do everything that you want it to do. The closest is the Ortiz PVAT, but only because it does the true peer comparison, and it in itself is limited only to receptive language. I mentioned the BESA, the Bilingual English-Spanish Assessment, another good test, limited only to age range 4 to 6'11", preschool transition. And it's only for bilingual English-Spanish speakers. It doesn't help with speakers of another language. So that's it. Beyond that, there is no right set of tests or batteries or whatever. You give what you want to give. The question really becomes, how do you give them, and in what order do you do that? And I was very specific in recommending that you give your tests in a standardized fashion and that you administer them in English first, if at all possible, given the caveats that I mentioned in the previous answer, and that then you follow up with native language versions of those same tests. And that's where tests like the CEL5 can be ideal, because you do have a Spanish version of them. And there are several other speech language tests that have Spanish parallel versions, which make that process easy. Do what you would ordinarily do with the test that you have, and then follow it up again with the native language test. And if you have a favorite test you like to give that doesn't have a native language version, then you may have to get to the point, as I showed during the presentation, where you have to translate that yourself and re-administer it in order to verify and cross-linguistically validate that there is a deficit regardless of the language. So it's not about what are the right tests, what's the right battery. It's more about how you give them and when you use them and for what purpose you're using them. If you put that into the framework that I just sort of demonstrated, then you can do it in a very logical, practical way. Doesn't require you to get anything you don't already have, and be able to conduct a very non-discriminatory assessment that is not only legally compliant, but completely defensible in terms of your decisions, because you would have established at least 3 layers of validity evidence to support your conclusions.
Thank you. As we consider validity and reliability, I know that out in the field, there was many questions also during the webinar about adding additional assessments to the CLIM, uniquely to the free version. Also, a question just popped up also. The attendee says, I use the test of integrated literacy and language. I forgot how to get that added to the CLIM. So are they able to add additional assessments on their own?
Okay, so they aren't able to add them on their own. They have to email them to me, So email it to me. Now, because I heard literacy in the title of that test, if the test is relying heavily on academic skills, literacy, then any subtests that measure that are not going to be in the CLIM. But it also said language. So if there are pure language measures, those could get included into the CLIM. So I'll just give you that caveat, but send me the name, ortizs@stjohns.edu. Send me the name of the test and we will do our research, investigate. I have my partners, Dr. Alfonso is actually one of the ones who usually obtains the test. We review, we compare it to other tests, and we find out what literature is out there on it, and we try to establish the CHC broad and narrow ability classifications, as well as CLIM classifications for the test. So just send me the name, I'll see what I can do.
Thank you so much for that. I know many appreciated you sharing your email during the webinar session as well, because there was lots of questions about various testing tools that they utilize and hoping to see them make their way into the CLIM. So thank you for that. As we also had a scenario come in, I was going to have Vanessa read that scenario because we love to hear about, again, scenarios that are practical that you're seeing in the field. So I encourage those participating today, if you have a scenario, again, we want to maintain confidentiality, but if you list a scenario in the Q&A, we'll definitely read it out, but I'm going to hand it over to Vanessa.
So it's a pretty lengthy scenario, but I think it's something that we can all relate, especially in the school site. The first part specifically talks about, okay, the student, we've gone through the assessment, used a CLIM, and the student did not qualify. However, the student continues to struggle. So what, from your research and your personal experience, what are the next best things that we could possibly do in the classroom for a student like this?
Okay, so I mentioned a couple already. One is peer tutoring. Making sure if the child is struggling, it may be that they really are very low in their language development and not understanding everything. So providing some mechanism by which they can get more comprehensible input, to use Krashen's comprehensive input hypothesis here. Somebody needs to make things understandable, because if they're not understandable, then it's difficult to learn them, okay? Calculus, that was kind of not very understandable to me, so I found it very difficult to learn. And it's the same idea. If it's just, over your head in terms of your ability to comprehend, then it's just immensely difficult to pull up. So the idea is a peer can provide that comprehensible input, communicate with the child and give them what they need, but make sure it's a very advanced peer, because they're going to lose a little bit of their instructional time while they're trying to help the other student. And then therefore they, you don't want them to suffer too much. So make sure they're not a kid who's already struggling. You also want to provide instruction that is matched to the child's language at that time. It's not just comprehension that you're dealing with, but also the type and parts of speech that you're dealing with. And I think I showed, for example, that the Ortiz PVAT broke things down into both the parts of speech, okay, which identified as first nouns, then verbs, then adjectives, adverbs, and then prepositions. Well, if a child is at the rudimentary stages of language development, then nouns and verbs are the things they've got to learn more than anything else. And focusing on developing the language from those elements will be most helpful in advancing the vocabulary more quickly to increase comprehension. Likewise, in terms of BICS and CALC, if you can determine where they are, and again, I showed you that graph, and maybe I'll just call it up here for you real quick, and you can see. Yeah, it just looks like this. And this is what I was referring to. And, on the left, on the top here were the parts of speech, but on the bottom, you have the word types. And so if I know that a child is supposed to be, let's say in 4th grade, 9 years old, and they're supposed to be at the advanced BICS level, that means they're just now beginning to transitioning into CALC, cognitive academic language. That means they should be able to speak the language of school. They should be able to read, efficiently, understand the text that they're reading. All these things should be in place. But let's say they're down here at the intermediate BICS level. Then what that means is their own conversational language is still not even good enough to fully understand what's going on in the classroom. And that means that has to be advanced. And if that's not advanced, then they're just not going to learn, because they're going to hear all the emergent CALP language and it's going to go right over their head. I used to have a demonstration that I didn't present this time around, but I sometimes give idioms in a very technical language. So I would use something like, let's see, it is impossible to instruct, what was it, an elderly canine in innovative maneuvers. And basically, it's a fancy way of saying you can't teach an old dog new tricks, right? But think about this. If the technical way of doing it is normal language, but your language can only understand it at the less technical level, then hearing the normal language is impossible for you to really understand. And that's what's going on. So the way that has to work is not only through direct instruction, but also through immersion as well, as much as possible. We forget that when kids go home, they're not getting their formal education. The schooling's not there. So anything like after school programs, summer school sessions, okay, helping the child have access to additional language models, videos, things where they can listen to people that are right at their level, that can help them move that on up, are going to be helpful. Even Stephen Krashen, was it Steve Krashen? I think it was Steve Krashen, or it might have been Jim Crawford, one of the two, was at NABE one time, and they were talking about how one of the best ways to engage children that are at a little bit lower level there is to allow them to use whatever kind of text appeals to them, including graphic novels, which is the term we use these days for comic books. But the reality was that graphic novels capture their interest and keeps them reading. And if it's at the level that they need to be at, then they'll progress through that and continue to improve and get into more complicated, more advanced levels of language. And it works beautifully. He had a whole program he was describing the success of it using graphic novels as the element of instruction. So that's what you can do. There isn't a whole lot else. Remember, you're always working against the clock. You're trying to make up for all of this time, and you don't have all the time in the world. Recognize that. But the more you can maximize the time you have, the more likely you're going to be successful in helping that child learn as best they can. I just think the worst thing to do is to say, well, you're in 5th grade now, so you need to learn 5th grade material, and that's all there is to it. If you don't modify that instruction down to their level, then you're dooming the child to not learning anything in 5th grade. And what are they going to learn in 6th grade? They didn't get 5th grade, so now 6th grade is going to be worse for them. And then 7th grade will be the same. They'll drop out of school. You've got to make sure all that instruction is at their level. I didn't mention, for example, Vygotsky, but I know a lot of teachers probably are familiar with Vygotsky and the zone of proximal development, and the idea that you can only learn what comes next. So the teaching, regardless of grade, has to be at the level of what comes next. Anything else will be ineffective.
Thank you for that. And again, as I mentioned earlier, the scenario had multiple parts. One of the other parts that it asked about was in their particular district, there aren't enough students, students don't come in perfect groups of 30 to have a designated period or time where ELD that is specific to English language proficiency can be provided when we're thinking of comprehensive ELD. What are some recommendations or some of the things you have seen being done for students where it's identified that it's due to language development and the school has no identified ELD program per se?
Yeah, I very often when I get this question, I will say that instead of thinking about the old way we used to do things where we had like these learning groups that were divided by ability level, we used to say, well, these are our fast learners and they don't need much instruction. These are our average learners and I'll work with them. And these are slow ones who are going to need a lot more help and so on. Turn that around and think of it in terms of language development groups. So if you just use the 4 basic levels of language development, you have the pre-production stage, right? The silent period where kids don't have any real expressive skills. And then you have early expressive skills, right? The early production stage. Then you have speech immersion. So now they can communicate, but not necessarily very, very well and so on. And then you have what they call intermediate fluency, which is not really fluent, but able to benefit from most everything that you say and understand it. So if you put kids in those groups at the beginning of the year, then you know that the kids who need the most instruction, it's not about ability, it's about the ones who don't understand hardly anything that you're saying. They need the most help. And the other ones need a little bit less, the other ones a little less, and the other ones probably not much at all. And then as they make progress, you can move the kids in the group because they will be moving up that developmental stage. So they don't stay there. And that was the problem with ability groupings is even if they were true, even if you were correct, your ability was your ability was your ability, then you never changed groups. You always had 4 groups. With a diverse set of individuals in a classroom, if you start grouping that way, it may end up by the end of the year, they're all either in the same group or you've broken it down from 4 now to only 2 rather than having it that way. So some of the groups will be getting bigger, some of the groups will be getting smaller. And that makes sure that your instruction then will be appropriate to the developmental level of the student.
Thank you. We also have a question that popped up in the chat, which is, I have a student who never had any formal schooling and was living in the outskirts of Mexico with limited, if any, opportunities for interaction, even with same-aged peers. A student later moves into a foster shelter in Mexico without schooling, and then now is beginning formal education in 7th grade. All skills, adaptive, cognitive, academics, were significantly low, intellectual disability range. Any recommendations on assessing individuals with all of these circumstances?
There are no recommendations. The reality is that a child under those circumstances is probably fortunate enough just to be alive. You're talking about isolation. You're talking about language deprivation, all of which, and probably I would say physical malnourishment, all of which are going to affect development significantly. How can you expect to be an average kid under those particular conditions? You have nothing that every other child has been given. You didn't start school at the age of 5, right? You didn't have enough food. You were, not worrying about being hungry, or you might have had, a place to sleep. You had all these advantages. You had good love and care, maybe from 1, maybe 2 parents. That's fantastic. This child has been just knocked around by circumstances so much that you cannot, the schools are not designed to make up that type of developmental delay. You can try your best and you can help, and you can help. But remember, at that point, if the child comes in and they are, what did they say, 7th grade? I forget. I mean, the child will be out of school in about 5 years if they're in 7th grade now. How are you going to make up all those years of development necessary to build to where they are at grade level, and yet they're not there because they didn't have all of that, and then catch that up in the next 5 years? It's just not possible. To me, for children like this, if I give a recommendation is, look, teach the child to where they are. And that's cognitively, linguistically, academically, and socially and emotionally, and even behaviorally. Teach them where they are and move up from there. Forget about how old they are. Forget about their grade. Teach them to continue to learn and improve the best they can. So by the time they age out of school, all right, even if they're in special ed, that's going to be at 22, you can say you got them as far as they could possibly get. Is that going to mean that they're going to graduate from high school? Probably not. But if you don't do that, what you will do is continue to foster a lack of capability because everything that you're doing will not help. And that means they'll end up in high school no better off than they are right now. And to me, that's tragic. So the best thing to do is let them learn, continue to help them learn from where they are so that they can progress as far as they possibly can. Good instruction will go a long way to helping them. And, if you can get a child to be functional, even at a 6th grade level, I think you've done a great thing given the kind of circumstances that you're dealing with.
Thank you so much, Dr. Ortiz.
Similarly, we have a question or a follow-up, I think, to this scenario is in these scenarios where we have students who have potentially have trauma in their background, like the scenario posed, how might someone then determine, again, is special education eligibility appropriate? And coming back, I think, to that disaggregation or those confounding factors of language difference versus disability. What are your recommendations?
Well, trauma is a different type of issue, and it's handled differently depending upon the impact it has on the development and on what type of development. So, for example, I don't know if I mentioned this, I think I did when I did the presentation. You know, if you're 5 years old and you've had a very absolute normal kind of development, and then at the age of 5, you suddenly start getting, let's say, sexually abused by a relative. By the time you're 7, your behavior very likely will be so out of control because you won't know how to deal with this. You won't be able to just come out with it. It will take such a toll on you mentally that your behavior will be very unusual. For example, I had a child one time who by 2nd grade, this actually happened to him. By 2nd grade, he would stand up during lunchtime on the lunch tables, the picnic tables that were outside, thankfully, and he would just urinate right off of them in front of all the other kids during lunch. This is not normal behavior. But in investigating and in doing an evaluation, we determined, well, this was because of the abuse he was suffering. So at that point, what do? Do we say, well, because he wasn't born that way, then he doesn't have a disability? That didn't make sense. And even emotional disturbance said, well, it can't be caused by environmental factors. So does that mean that because it's a relative, it's an environmental factor, that's not something he was born with, he doesn't qualify? We said, heck no, he qualifies. And we said he has a disability and he acquired that disability through the life circumstances that he had. Trauma can be the same thing. If you acquire difficulties on the basis of trauma that you have experienced, you can't think of that as real physical, emotional, mental impact on a person's development. Just as if they had been hit over the head, with something hard and caused traumatic brain injury. So therefore, I don't think you have to worry about saying, oh my God, they can't be in special ed because it could be a cultural linguistic difference. Trauma has its own effects, okay? And poverty has its own effects. Isolation has its own effects. Malnutrition has its own effects. And those things should be considered absolutely seriously as having an impact above and beyond what likely can be explained by cultural linguistic factors. If you're worried that maybe their cognitive development was affected, you got the CLIM to be able to look at it. But I guarantee children with those types of backgrounds, they're not going to perform, average across the board. They're going to display some significant difficulties because of the nature of what they've gone through.
Thank you. I truly appreciate that as I think of all of the different factors that any one student can bring into a scenario, and our school psychologists, speech therapists, assessors in general, whether OT, PT, speech, they're having to take all of this information in and adequately interpret information, ensure, again, validity and reliability of assessments. And one of the things that I appreciate that you shared during the webinar with those who participated was looking at their own validity statements and reflecting on what were my assessment practices, what did they look like, and indicating, and I wanted you to share a little bit more about this again, because it really resonated with me as you discussed primary contributory factors and primary determinants. If you could share a little bit on that, thank you.
Yeah, I know I was talking about it when I got to the exclusionary variables, so let me see if I can call that back up. Here. Okay. So I did show this particular document that's available freely on the web, publication that I did with Megan Whitaker, lawyer for NCLD. And in there, I really tried to highlight the use of terms primary and contributory. This works well in two ways: validity statements as well as eligibility determination or conclusions regarding the presence of a disability, okay? So the law is clear that if the primary determinant for a student's observed academic difficulties. So if you do those first two steps in the broader framework and you find, yep, they're not learning to read very well. Yep, they're having trouble in math. Yep, their writing really stinks. Okay. But if then we conduct an evaluation and we determine that those poor performances academically are due primarily to cultural linguistic issues, then that means that child cannot be identified as having a disability. That's not the basis of a disability. Okay. For there to be a disability and to be demonstrating eligibility, the child must be said to have and possess a disability in one of the 13 categories that are permissible and meet the criteria for doing so. And that is the primary reason why they're having the difficulties that have been observed. Okay. Culture and language can be contributory and still permit there to be a primary disability. So culture and language aren't going to go away. You don't say, well, the kid's disability is not due at all to culture and language. You can say culture and language may well be making it worse, may be contributing to the problem. Yes, nothing we can do about that. But you have to be able to say culture and language is not the primary reason why those problems exist, that it's the disability that is the primary reason why those things exist. So I love the language, I love contributory, because it allows you to say that culture and language are there, that you've considered them. And in fact, when I was talking about the CLIM, and I think if I go down to, yeah, I guess I can go to right here. You know, when you're saying that it's a disability, what you're saying is that the scores are not within this range. In fact, they are lower. And since culture and language can account for scores that are within that range, that follow, like in this case, that blue line, if those scores, as they are in this case, are all right there, then everything can be accounted for primarily by culture and language. But if one of those bars, it only takes one, is lower than where that range is, then I can't say that that's just culture and language. I have to say that's due to something else. And I called it below and beyond culture and language. I tried to coin a new English idiom there because it's supposed to be above and beyond, but no, it's below and beyond, culture and language. So therefore, it could be the primary reason. Remember, CLIM doesn't tell you that's the case, but you're going to move on and make that case. And that's why in your validity statement, you want to make sure that you say culture and language are not the primary determinants of the scores that you obtained in this particular case. Then when you get to your conclusions and impressions and you're saying you think that the child's scores are consistent with other children who may have a disability, then you want to say that culture and language are not the primary determinant in the interpretation that you're making, because the interpretation that you're making is not fully accountable for by the presence of cultural linguistic factors. They may be contributory, they may be minimal, they might not even be that present, right? I showed you some examples of, hey, cultural language sometimes not really affecting anything. That's fine. But you want to make sure that it is no more than contributory if you're determining that there's a disability. And I think that language is very, very important.
Absolutely. Thank you for that explanation. I think every time I hear you explain that, it just resonates again amongst the various assessments and questions that we've also heard. I know also in your presentation, you shared some sample validity statements. So for any participants who are here in the Q&A and did not attend the original webinar, I highly advise that you watch the webinar. It can be found on the Imperial County SELPA website. And there are some nice validity statements to support your practice in the actual handouts, and the handouts are linked in as well. So with that, there is a question in the Q&A, and it asks any tips that you might have, Dr. Ortiz, on assessing EL individuals with autism who have difficulty with communication. And I would add to that perhaps even students who have a primary language other than English at home, but who actually have no receptive expressive language or maybe a nonverbal.
Yeah, I often go back to trying to understand the purpose of the assessment, okay? So is the purpose to determine whether the child has autism? And if so, do you have to give a comprehensive cognitive battery to do that? Not necessarily. you have other elements that you can use. For example, autism rating scales. You have comprehensive behavior rating scales. You have several different options that will allow you to say that you believe the individual probably has autism and therefore qualifies under that particular category. Now, that said, you sometimes want to know where they are cognitively, because this may have implications for their instruction. And that may be what's driving the question. So how then can you determine those cognitive abilities if they can't really work with you well at all? And in those cases, it's perfectly okay to do whatever you can. In other words, do an evaluation that will give you as much information as you need, the best you can get it. If the child has no expressive skills or is not able to articulate responses, then there's not much you're going to be able to do when it comes to expressive language skills or tasks that require the child to express their language, which means you're going to rely heavily on nonverbal types of testing to be able to do that. And for language, you're going to rely on things like listening comprehension or receptive language types of tasks, if there's sufficient receptive language to be able to even test them. So you modify, and that's perfectly okay. Just test the areas that you can and try to be as broad about it as you can. And I think that if you combine, tests, and this may be not from a single battery, by the way, but from many different batteries. There'll be a lot of cross battery involved in there, not because you're trying to measure all 7 broad abilities, but simply because the limitations of the child's abilities prevents you from being able to evaluate everything in a straightforward way. And so you just alter that testing in ways that you think will give you the information. What can they understand? What can they do? What kinds of abilities can you measure? And what can you say about those abilities? And even those can be put through the CLIM if you want to determine a cultural or linguistic effect, because autism itself is not expected to and does not show. I actually didn't show that sample. Somebody did do a weird study before, the Stick and Watkins studies that I was showing you, that were very consistent with what the CLIM said, despite the authors concluding it backwards. They actually had a 5th sample that was autistic kids who were monolingual native English speakers. And I don't know why, but they wanted to put their scores through the CLIM and they found absolutely no pattern. And I'm like, yeah, because me personally, I've never uttered the words autism and CLIM in the same sentence before, because I don't know. I don't think there should be. I don't think autism has this declining effect unless it is based on language only. But why would autism be language only? We wouldn't be calling it autism if that were the case. We'd call it speech language impairment if that were the case. So evaluate to the best of your abilities and to the best that you can, recognizing limitations. I'll tell you, one time I was asked to evaluate a child, a young girl. She was in, 3rd grade. So she was 8 years old. And she was born with agenesis and dysgenesis of the corpus callosum with cerebral atrophy, significant cerebral atrophy. Okay, so no expressive language skills at all. And supposedly very, very cognitively impaired. Attending, by the time I did the Triennial, a private school for children with developmental disabilities that were pretty much profound. So she would not allow people or strangers like myself to approach her. No testing possible whatsoever. So what did I do? I literally followed her all day during one of her school days. I observed everything she did, every interaction she had with every teacher along the way, with every professional that was working with her, and observed her. And then I went to her house and did an interview using, I think I was doing the Vineland probably for adaptive behavior, with the mother while the child was there as well for additional observations in the home while I was there. And that was one of the best evaluations I ever did. And there was not a single standardized test actually used for that entire evaluation. So do what you can, because that's all you can do.
Thank you. I appreciate that. I can only imagine the challenging cases that are out in the field today, and taking into consideration all of these factors, cultural, linguistic, areas of suspected disability when there may be more than one in those scenarios, and navigating through. One of the questions coming back in the chat box to systems, I think systems change, I think is always the question, and how to ensure supportive practices and services for English learners when perhaps it might be a very small school, maybe a rural, small and sparse district. So the question in the chat box is, can you describe what a late exit maintenance program would look like for a small elementary school district with relatively few English learners?
Yeah, so that, I mean, it's not impossible to do, but it might be difficult depending on the numbers, obviously. Oh, hold on. Let me share my screen and I'll show you real quick here. This is the Thomas and Collier graph that shows the different types of programs and the achievement gap, et cetera. But what's important about them is, the late exit bilingual maintenance type program is the green line. And that's where you have a program where you teach in the native language, okay, for core content in particular. So it doesn't matter, don't think of it in terms of percentages, think of it in terms of subject matter. Reading, writing, and math in the native language from kindergarten through at least 5th grade, usually better to 6th grade, but 5th to 6th is about the right sweet spot. It's got to be that much. If you do it too early and it at 2nd or 3rd grade, that's a transitional type of bilingual program, early exit, and that's the fuchsia colored line in the middle there. And you can see it helps, but it doesn't get you up to grade level standards. Only the green line does, because you never throw away that development. Now, how would that look? Well, those kids have to have reading, writing, and math instruction in their native language all the way from kindergarten through minimum of 5th grade. And that's it. They are learning, by the way, English on the side. It's not like, oh, they're not getting any English. Yes, they are. They're going to be learning it even when they're on the playground with their friends. You're going to see that. But they are allowed to learn English informally and just picking it up. They're not getting core instruction in that. Because if you do core instruction in reading, you're taking it away from the Spanish side and you're inhibiting and delaying their development in Spanish or whatever other language it might be. So therefore, that slows the process down. Keep it, not like 90-10, 80-20, 70-30. Don't do that. Just do reading, writing, math all the way through, all the way to about 5th to 6th grade. And those kids then will get to grade level by about 8th grade, and they'll maintain that, probably slightly a little bit higher. And in terms of, systems change, I often liken systems change to guerrilla warfare. You have to kind of do things a little underhanded to make it work. And for example, when I was working in Encinitas at the elementary school that I was at, my first year that I was there, I did no change whatsoever. I was the new kid on the block, and I had to get to know everybody, and everybody had to get to know me. That was year one. Second year, I began telling people, okay, I can help you with this, or I can do this, making little changes and things that I thought that people who were amenable to it would probably like, and putting those in place by that second year. By the end of my third year, I was doing greater types of changes. I had gotten the teachers to trust me, to understand exactly what I could give them. By the end of the third year, I had converted pretty much everybody that was against me in the beginning to seeing things the way that I thought we could do them better, collaboratively, more efficiently. And I had dropped the number of referrals for evaluation by half at that point. And teachers knew that I was there for them, that I was working with them, not against them. And it took 3 years to begin to make that level of change. Now, if I wanted to do more than that at the district level, it would have taken probably many more years. So you got to ingratiate yourself. You can't do it by just going in and demanding and saying, doing it this way. They got to earn your respect first. They got to see that that they have to see that you know how to do it the way they expect you to do it. Great, even if it's wrong or bad. But start changing that in your second year and in your third year, offering new ways, better ways of doing it, little by little, and they'll just eat it up. And you make that kind of gradual change, that's what will make you successful in getting to the systems level and creating the kinds of change that you hope to see.
Thank you very much. We have another question in the chat box, and this might be the last question if we don't have a follow-up to it. But it's a very, very good question, as many districts have shifted from a discrepancy model to a PSW model. And this question specifically is that, what are your thoughts on the strengths and weaknesses versus discrepancy model to determine SLD eligibility for EL students?
All right, that's a good question. So let me go here. All right. So the old discrepancy model, let's see if my pen works, it does. The old discrepancy model was kind of just this. People would choose over here some kind of full scale IQ score. Down here, they'd just get some kind of achievement score. Then they would do subtraction and say, well, let me see, it's 100 minus 73, that equals 27. And they'd say, well, that's greater than 22 and a half or 23. So there's your discrepancy, and that must be LD. And that came about because they were thinking, well, 1.5 standard deviations. If one standard deviation is 15, then another half is 7.5, and that's where you get the 22.5. Now, the only thing that was actually sane and reasonable about that is that the expectation of the achievement probably being somewhat, not perfectly, but somewhat consistent with the full scale IQ, okay? In other words, if you have this level of general ability, should your achievement be around that level too? And that answer is yes, in general. But there were major problems. One of the major problems was that the full scale IQ is comprised of the very cognitive weaknesses that cause the learning deficit. So when they're included in there, what does that do? It reduces your full scale IQ, so now you're only a 90. And then I start subtracting from 73 and I get 17, not 27.5, not greater than 22.5, and therefore not LD, which was, again, insanity. That's not the way that it works. So PSW is really not necessarily a framework all by itself. You still have to have an operational definition of what LD is. In XMAS, we use the DDC model, the dual discrepancy / consistency model. So this discrepancy is still there, but it doesn't use the full scale IQ. It uses overall ability as measured by the facilitating cognitive composite. We call it the FCC. And that is an aggregate of ability that is comprised of the strengths of the child without the weaknesses in there to attenuate it and bring it down. It's also related to, I probably should go back a bit. Let's see if I have it. Whoops, that's the wrong one. Let's see if I have it back over here. Yeah, this is probably even better here. So that's the FCC, okay? It doesn't have those weaknesses. Plus it's combined with this G value over there that tells you, does this child have good overall general ability without having to use a full scale IQ at all? Don't need it. Then it looks at the achievement score, which is down here. And instead of first just subtracting them, what it does is it does a statistical test to see if these two scores are actually statistically significantly different. This is very sophisticated and actually required, because if those two scores are the same on the basis of reliability that may be poor, or intercorrelations, which are very poor, right? The higher the intercorrelation, the greater the reliability, then the closer those scores ought to be. So we test that. And what that means is that, yes, right here says those two scores are not the same. Okay, but that's not enough. We also then look at the difference, and we regress the the FCC on the achievement to get a predicted score, which is, by the way, required by California Code of Regulations. I did not cover this, but California Code of Regulations, section 3030J, I even remember it from my time in California, says that you are supposed to examine, all right, what is called the difference, okay, and that difference should not exceed 1.5 standard deviations of the distribution of difference scores, not the distribution of each of the scores, and not the standard deviation of each of those scores, which is 15. It means the distribution of different scores. What is that? That's this score. You take this score and you say that from that is about 17.7 points or almost 18, okay? And then you look at that 18 and you compare it to the distribution of different scores, which means if I gave these two tests to this particular individual over and over and over again, I would get sometimes a small difference, sometimes no difference, sometimes a large difference. If I create a distribution of those differences, how often is 18 going to come up? And if 18 comes up, let's say less than 10% of the time, all right, so at the 10th percentile or less, then that makes it unusual by definition. And that's a consensus thing. And that's what this is doing right here. And that means the difference is not only large and real, it is also infrequent enough to exceed the 10% base rate, which means then it has been established as being unexpected underachievement. That alone is far more advanced than anything people are doing probably even right now. And that's not even the entire operational definition, because we then include similar procedures on this side for looking at the cognitive weakness to make sure that it is exactly statistically significantly different from the overall ability, and that the size of that difference is also exceeding the critical value at 10%, so that we know that it is truly a cognitive weakness. And then we're not done with all of that, having these two, we then look at this relationship down here, which is whether or not the cognitive weaknesses on the left can explain, literally explain empirically, the academic weaknesses on the right. And so what you see is that the old ability achievement discrepancy was just a very poor operationalization of LD. Not enough, and the way that it was being carried out was not compliant with California regulations. One of the reasons California likes our DDC model, 100% compliance with the California Code of Regulations. It covers everything to make sure that the determination of LD is rigorous, it's sophisticated, and that it is not subject to the kinds of difficulties that we saw before, where people were handpicking kinds of scores, doing, let's say, funky mathematical calculations that didn't mean anything, and not following what the law was actually saying. So do I like PSW? Yes, I do, but it isn't just PSW that really is making a difference. I think it's our DDC model that I think does it, because not all operational definitions of LD that rely on PSW do all of this. Some of them still just do intra-individual discrepancy analysis, which is still not California compliant. So PSW isn't the answer, it's the operational definition that is the answer within a PSW framework. I hope that makes sense.
Thank you. As I know, many districts are investing time and resources into further identifying the application of PSW and identifying models that are working, how to train staff to further explore the appropriateness as we continue to come back to validity and reliability, and how we interpret that information to ensure, again, that we are eliminating, or to the best of our ability, indicating that it is not due to, or solely, or like how you say, primarily determinant on cultural and linguistic factors. And again, that contributory is something that we acknowledge. And in the same respect, wanting to ensure practices that will not over-identify English learners as students with disabilities, or nevertheless under-identify either. To say, well, we're not going to continue to assess because of language difference, but knowing, again, best judgment interpretation is very much at the key of all of the work that we do. I want to thank you absolutely for your time. Dr. Ortiz, I think these were great questions. Every attendee that submitted a question, we thank you and appreciate your questions. This session is recorded and will be placed on our website. Again, Dr. Ortiz, I can't thank you enough for your knowledge, your experience, the practical application that you share with us. I can't tell you enough how grateful we are, how honored we are to also be hosting this session through our Content Lead grant work, which is improving outcomes for English learners with disabilities. Your time is very valuable, and to spend it with us, again, our utmost appreciation. I do want to transfer it over to Vanessa really quickly so she can navigate through the website, just so participants will again know where to find the video, where to find additional resources, and our upcoming trainings that we do have scheduled through our grant work. So thank you again.
Very welcome. It's been my pleasure. Thank you for having me.
All right, so I'm going to share my screen. While I'm sharing my screen, can you see our website? Debbie, can we see it? Okay, fantastic. So just very briefly, I want to keep you up to date with some of the latest developments within our website. You can find all resources related to improving outcomes for English learners with disabilities housed within Imperial County SALPA's website. If you scroll on down on this purple bar, you will see that we have some training modules and training opportunities. If you're interested in joining us for future trainings, just go ahead and navigate over to this section, and you will find our October, November, January, and offerings continuing on until the rest of the school year. Our next upcoming one is part 1 of a 5-day series based solely on the California Practitioner's Guide for Educating English Learners with Disabilities, starting with section 1 in October. Then in November, we're offering Meeting the Needs of English Learners with Moderate and Severe Disabilities. January, we pick up day 2 of our 5-day series on the Practitioner's Guide with section 2. Then following later on in the month, we'll be writing linguistically appropriate goals and objectives for English language learners with disabilities. This will be workshop style where you'll get to work out some linguistically appropriate goals and objectives. Following up in March with day 3 of section 3 of the Practitioner's Guide. In April, we're moving on to section 4. Followed by pathways towards reclassification for students with significant cognitive disabilities, and finally ending up the school year in May with part 5 of the California Practitioner's Guide, an overview of section 5. So again, feel free to navigate to this area of our website, click open the link to read our intended outcomes, and go ahead and click on that OMS button to register and attend. I want to call your attention over to the resources tab. As you hover over and across, you will see that our drop-down menu will populate, providing you with some topics. If you'd rather look at the resources page all in one page and see what is available here, you can take a look and find out that you'll have resources related to the Practitioner's Guide, frequently asked questions, CDE English Learners with Disabilities website, the EL Roadmap and Toolkits, ELD Standards, LPAC, SPAC, infographics, and additional resources. If you're interested in navigating the California Practitioner's Guide, you can do so here. It's been divvied up into 5 sections with its corresponding chapters, accompanied by downloadable appendices that relate to every single theme and topic that the Practitioner's Guide takes on, along with the figures referenced in every single one of those chapters. Returning back to our resources tab, if we move over to the FAQs, you will find exactly that. Frequently asked questions that relate to those chapters within the Practitioner's Guide. You can peruse the chapter listing, read the title, and if you have any frequently occurring questions that you come across often, simply click on the accordion menu and those frequently asked questions will populate along with the question and the answer and an active link that will direct you back to the Practitioner's Guide where you can access additional information specific to those questions. The next tabs are pretty self-explanatory, resources related to the EL roadmap, ELD standards, LPAC, CASP, and infographics. It is here in the infographics section that you will find some companion guides to the California Practitioner's Guide. Again, as I noted earlier, the California Practitioner's Guide is divided into 5 sections. Each section has its corresponding chapters, and here you will find a visual guide to the California Practitioner's Guide, which is a pretty hefty compendium of information. So you will be able to take a look at an individual chapter, say you're curious to learn about all things development of an IEP for English learners. You hover over, locate the pop-out button, click it open, and it will populate the infographic on one page. All of the links contained within the infographic are active links. When clicked upon, they will direct you to that specific section in the chapter. For example, if I want to look at the infographic and I want to read a little bit more on the key tasks of the IEP team, you can see that just by hovering over this section, it allows me to click and it'll take me to the practitioner's guide into the section that deals specifically with the key tasks of the IEP team. Blue links you see in these sections are also active links that you can click on and access. Going back to our website, to the infographic sections, if you keep scrolling and you want to refer back to as to how to view our infographics, access them and apply them into your daily work, we've embedded a video here for you to use as a guide. Following below, we have one of our newer publications, which is Debbie's Alternate LPEC Guide. That is available also for you to pop open, print out, save, share out. All of these are available along with our alignment of evidence-based practices for English learners on the autism spectrum. We've taken a look at evidence-based practices and aligned them to EL strategies and provided links to some of the EBPs for autism that will direct you to those AFFIRM modules that deal specifically with those EBPs. Again, we hope that the resources that we've developed and provided for you are useful to you. And again, feel free to access, share, remake some of these resources. They are free and available for all practitioners, all individuals equally committed to improving outcomes for English learners with disabilities.
Thank you, Vanessa, and thank you again to all of our participants joining us today. Again, our distinguished speaker, Dr. Sam Ortiz, and all of his knowledge. We appreciate all that you do for our community and continue with advocacy for all things improving outcomes for English learners and English learners with disabilities. Our sincerest thanks to everyone and our collective commitment to improve outcomes for students in California. Thank you so much. Enjoy the rest of your week and your weekend, I should say. Thank you.
Bye-bye, everyone. Thank you, Debbie. Thank you, Vanessa.
Thank you, Dr. Ortiz.